So treatment option for worn teeth, you can categorize in two category only for people. Now, worn teeth status, you have to check and whether patients have extra oral symptoms or not. If teeth, then by doing a 3D scan, you can check the 3D scan and see whether teeth are worn or not. Canine tips worn, multiple teeth, cusp tips worn, facets are there, or the occlusal signs. And if the patient has TMD symptoms, extra oral TMD symptoms, undiagnosed facial pains, teeth are worn, and if you are treating the teeth at current occlusion, my dear friends, you are making a big blunder. It is going to worsen TMD. So whenever you see worn teeth, symptomatic patient, you need to protect the occlusion. Then only the TMD will be reduced, because you have to consider the joint, because worn teeth means jaw imbalanced. Symptomatic means because of imbalanced jaw, there is a condyle and associated muscle are in strain. So the patient is complaining of those extra oral symptoms of TMD like migraine, headache, clicking jaw joints, muscle tension of jaw, neck pain, hair combing, pain, discomfort while combing hair. So those are extra oral symptoms, and intraoral you have to see with the 3D scan. So worn teeth, symptomatic patient, if you treat the jaw, if you treat the teeth with only aligners and you don't restore the teeth because they are worn, means the teeth have there are no tips. When you see the tip here, the tip is worn, the canine is worn. If the canine is worn or upper teeth are worn like this, this is non-worn status, means teeth are not worn. You can see the incisor edges, and this is non-worn. Canines are non-worn. So whenever you see worn teeth in 3D scan and the patient complains of TMD symptoms, if you treat the teeth by only aligners, your aligners means only alignment. Simple. That's why they are known as aligners. So that means if you are treating the teeth at current occlusion by aligner or by braces, you will end up with further symptomatic and further wear of teeth, because you have not corrected the bite. So worn teeth, symptomatic, I'll emphasize again, you cannot treat that at current occlusion. You have to give deprogrammer as an interventional therapy to treat the symptom of, relieve the symptom of pain, discomfort, occlusion, that is known as occlusal splint, and then once the discomfort is reduced, do for thorough checkup of all the muscles of mastication and neck, all related to TMJ muscles, whether it is cerebral masseter, trapezoid, masseter, medial pterygoid, lateral pterygoid, temporalis, any muscle which is attached to TMJ, you have to consider TMJ whenever you see bone status of teeth and patient complains of symptoms. So on the below link, if the patient has symptoms related to TMJ, first 16 are related to TMJ, extra oral symptoms. You treat the teeth at current occlusion, whether by aligner or by braces, you will end up definitely for further wear of teeth because they are going to collapse again, and symptoms might again worsen. If you want to improve the symptoms of TMD, you have to consider giving them balanced occlusion, which is mutually protected. And to give a balanced occlusion, you have to know how much is imbalance. To check the imbalance, you have to do bite analysis. Bite analysis includes Facebook records and centric records. Means you need to know whether the upper jaw is tilted here like this, up, down, this angle, this angle, this angle, this angle, that is by Facebook. And to record the lower jaw according to the upper, you need to see the centric record. Whether the lower jaw is tilted here, we don't know. So both have first you need to check the imbalance and then correct the imbalanced occlusion by it. You cannot treat only by just giving a blindly by aligners and just doing a braces. You have to consider the TMJ in case the patient is complaining of symptoms of TMD, and especially if it is worn teeth. So any patient with TMD, you have to give balanced occlusion to relieve TMD. But to give balanced occlusion, first you have to relieve the pain. So deprogrammer or splint has to be carefully given, but splint cannot be worn for more than 2-3 months. Consider that. Otherwise the teeth will supra-erupt. Whether we do simple alignment plus restoration or only restorative therapy, that is different. We don't know. But first we have to do the bite analysis to check the imbalance. Then only you will correct the balance, because you have to give balance occlusion which is mutually protected. So today I have just explained one flow chart. Worn teeth, symptomatic patient, you need to give a balance occlusion. Worn teeth, symptomatic patient, if you give a treatment, if you treat at current occlusion, you are going to have further trouble. So also for general people to know that whenever you see your teeth, canine tips are worn or some teeth are broken in the front, edges are broken, and if you have extra oral symptoms, you cannot go for only alignment. You have to go for restorative alignment or only restorative phase. That will depend upon checking the imbalance. So you need to consult the dentist who does bite imbalance correction, not only alignment. Alignment is different, balancing is different. Some people need more balancing, some people need alignment. So before placing aligners, you see yourself whether you are symptomatic or you have a worn status of teeth. So ask the question to the doctor, if what will happen to my worn teeth and what will happen to my TMD symptoms by putting the aligners only, whether they will be corrected or they will worsen, and what happens to my TMD symptoms. So treatment is clear. Okay, this is a complete flowchart, but today I have explained for worn symptomatic status. If they are worn non-symptomatic, I will explain in the next video.